Ventilator modes seem confusing. Let's make it simple.
What are the ventilator modes that are available? Okay, so there are three important modes that you should know. First one is control mode ventilation. We use this mode when the patient cannot able to breathe by himself. For example, when he is sedated or when he is paralyzed. So here, everything will be controlled by the ventilator machine. Second one is assist control mode. It is similar to control mode ventilation, but the only difference is there will be minimal respiratory effort from the patient side. So when the patient tries to take a small breath, it will be immediately sensed by the ventilator and it will provide the breath of particular volume or pressure or respiratory rate that we set. Third one is synchronous intermittent mandatory ventilation. This mode is used when there is spontaneous respiratory effort from the patient. So here, first 1 or 2 breaths will be completely taken by the patient. The ventilator will never help. However, third breath will be provided by the ventilator to meet that adequate respiratory rate or adequate tidal volume. So 50% of effort will be by the patient and 50% of effort will be by the ventilator.
Then know about CPAP. CPAP weaning is the process of gradually reducing the amount of continuous positive airway pressure a patient needs until they no longer require it.
Master ventilator settings, one step at a time. Learn with us. Stuck on anything? Ask us in the comments.